All right, Chris, not as popular as the forecast. The room has cleared.
Well, they were a very smart audience, so they found something better to do. Good afternoon, ladies and gentlemen of the Budget Committee. I am the last discussion item before you get to your agenda, and this is the usual update. It will be a little bit different, even though we called it the CARES Act funding and American Rescue Plan. The CARES Act funding is closed, and so we finished administering all of those funds. And so today, what I'd really like to do is give you an update on the American Rescue Plan and specifically spend a little time about, and we talked about this before, the unallocated funds, because that is the first review item on your agenda. And then we'll also give you an update on the goings-on of the bill or bipartisan infrastructure law, or the Infrastructure Investment and Jobs Act. So on slide 2, really the American Rescue Plan, what we have focused on is the State Fiscal Recovery Fund, and that is the fund, or both these funds, that and the Capital Projects Fund is what got appropriated in 2021. And as I mentioned, there is a portion of that can be still allocated, and that is the first review item on your agenda. On slide 3, it's a slide that we've had in previous presentations, but this really is a recap of that funding. And so you can see the State Fiscal Recovery Fund at a little over $3 billion. The Capital Projects Fund, which is very specifically focused on broadband deployment, at $203 million. So the two of those together were $3.25 billion. In 2021, the budget appropriated $3.1 billion. What we found after the rules came out, the final rules came out for ARPA, was that $75 million that was used for the pledged for the Career Accelerator Fund was not going to be eligible use on how to use those funds for the purposes of the accelerator. And then I believe it was in June, we brought forward several items for review to allocate the American Rescue Plan funds to those. And some of those included additional funding to ILEA, administrative costs, oversight, and a couple others. And so that nets out to the $190 million, $0.1 million, which we've have talked about before. And so on slide 4 is the appropriations summarized by functional categories or programs. And for the most part, I would say that all of these programs are moving forward. The agencies that are responsible for administering these have stood up the programs. I know Senator Melton the other day was asking about one of the, I think it was $1.2 million for the intermodal study in Buffington Harbor, and I will also follow up with IEDC to make sure that was moving forward. I think they've put it out for bid and was under review, and they're making a final decision on moving forward, but I'll follow up on that as well. But for the most part, all of these other programs are in process, and so happy about that. And but you can see below the State Budget Committee review item of the capital reserve allocation of $190.1 million, which will be discussed about directing that to the capital reserve account. Zach Jackson earlier in the week, or I guess it was last week, talked about our capital projects and some of those funded from that capital reserve and the challenges that we face with inflation on those projects. And so that is the purpose of that recommendation. One item on slide 5 in the ARP dealing with the broadband projects, that was a $250 million appropriation, of which 203 is coming from the Capital Projects Fund. The remainder will come from the other fund, the $47 million. The U.S. Treasury has awarded us for $187 million of that, so there's still 22, let's see here, 181 projects. So we have $22 million left of the Capital Projects Fund, still have the $47 million for the State Fiscal Recovery Fund. The intent is this spring is to sort of put together the final round of the Next Level Connections broadband funding for these remaining funds, and do that, put that out to the marketplace. In the meantime, we'll talk a little bit about some funding, planning funds that we've received. So we're transitioning away from the American Rescue Plan into the infrastructure bill, and that included a couple of items. The acronym is BEAD, but it's for broadband, equity, access, and deployment. And that's a separate program that now you have to develop a plan and submit it to the NTIA and NIST to get the approval for that to then deploy those funds. Each state will get about $100 million, and then the remainder of the funding will be determined by hopefully better and improved FCC maps as far as where service is or is not provided. So on to the infrastructure bill on slide 6. Just a reminder, there were 5 general program areas: transportation, environment, broadband, which we discussed, cybersecurity, and energy. The competitive grants and formula grants, just as a reminder, the competitive grants, there's many of those that are being created by the federal government, but they're the lesser of the dollar amount. The formula grants they're fewer in number, but it's the greater dollar amount. And so examples would be NDOT is receiving additional money just to do what they normally do with federal highway funding. This SRF program over at the Indiana Finance Authority, water and sewer projects, they follow the same SRF guidelines. But what they're able to do is go deeper into their list, their waiting list of projects to be able to knock those out. Recent activity on the following slides, starting with slide 7. In the transportation area, the NDOT has put in proposals for 3 programs: the Bridge Investment Program, Rural Surface Transportation, and a program called Reconnecting Communities. Those applications are still pending at this time, and there's a couple that were not selected. NDOT was not selected on their RAISE grant opportunity. That was at US 36 and Rockville Road. It's not that the project won't be done, it's just that instead of using federal funds at this time, they'll just reprogram that with the normal funds that they have. And then I had mentioned before that NICD and the Northwest Indiana Regional Development Authority had put in an application for transit-oriented development districts. And they've been, I think 2 meetings ago, they came here and presented their transit-oriented districts. I believe there's 7 of them in the Northwest Indiana area around the different stations, and really promising a lot of great work there. This was the first time that they had ever applied for that, so that may be the reason why they just didn't hit. They were competing against the Washington rail system, New York City, San Francisco, but there'll be future rounds for that, and there may be opportunities to help out on that. It does not diminish at all their planning efforts. I mean, the RDA has done a fantastic job as far as coordinating with the communities and establishing their districts around the stations. The Office of Energy is looking at grid innovation, which is dealing with transmission, storage, and distribution innovation. There's a match, not from the state, but match from the utilities. Could be upwards of $250 million. But part of this requirement is to submit a concept paper, which then has to be reviewed, and then a full application. You get invited to put your application in, and that occurs in May. Right now, OED, Office of Energy Development, is working with the utility associations in collaboration to put that concept paper together. On slide 8, Homeland Security and Office of Technology is still working on the cybersecurity activities. I gave you an update on that last time. I mentioned the broadband planning grants. The first is digital equity, which looks to identify where there are access issues, affordability issues, lack of adoption. Is there need for digital literacy on different groups, veterans, the elderly community, disabled community, and putting a plan together for those efforts. Those will lead to what they call state capacity grants. So once you put your proposal, your plan together, they will review that, and that opens the window for deployment in implementation grants. The BEAD award was $4.9 million. That was just awarded a couple of weeks ago. And as I mentioned, you need to put a plan together in the next 8 or 9 months. And then that opens the window, after they review that, opens the window for every state will receive $100 million. And then after that, part of this planning process is reviewing the FCC map and challenging. You have an opportunity to challenge the map, and then they make a determination of where we stand compared to other states as far as underserved and unserved communities or areas of the state, and then that determines what the future funding level on top of that $100 million may be. Those two plans really need to work together because they are complementary. If you've got barriers in the digital equity planning that you've identified, then obviously you want to be able to get the greatest amount of funds for that. And so those two planning efforts will be synced up, if you will. At DNR, they had received in a formula grant $25 million to cap orphaned wells, and so there are 13 projects for 342 wells, and they've just started. Some of those projects have been given the notice to proceed, and the remainder are in the contract development stage. Then the last slide is in the Office of Energy Development. Their total grant is about $9.5 million. They received the first chunk. They sort of seed it with $100,000, and then the remainder will come in over time. The Efficiency and Conservation Block Grant, this was a program that was actually started back in 2009, fulfilled its mission from the federal government, has been dormant, and they're sort of revitalizing that, and the application window is expected after the first of the year. And then Housing and Community Development have submitted the application for weatherization program. That's under review. And then LIHEAP, the Low Income Home Energy Assistance, they've just been awarded $3.5 million, and they'll be deploying that. Again, that's just additional funding for a program that they've already administered. And then finally, IDEM is looking at a relatively smaller grant for solid waste infrastructure for recycling. And that's due, well, it's due today. I'll have to follow up on that and make sure that application went in. So I'll stop there and see if anyone has any questions.
Questions for Chris?
Just a small one, and the last one, IDEM, because we have solid waste districts, and I know the one in my county disbanded after legislation passed enabling to, but I'm curious what this is going to look like since the locals do this. You can get back to me.
I'll give you a summary and send it to you.
Thanks.
Yep.
Anyone else? All right. Yep. Thank you, Chris. All right. So we kind of did things backwards today because we did the discussion items first because of the revenue forecast. So y'all have the minutes from the last meeting. Is there any amendments to the minutes? Is there a motion for the amendment?
So moved, Mr. Chairman.
Minutes.
Second.
All in favor?
Aye. Aye.
Opposed? You got a proposed agenda. It's also been released to the public. Are there amendments to the proposed agenda for today? All right, then the agenda is placed on the table for discussion. So first we have the agency projects. We'll start with the Department of Administration, Matt Kent.
Thank you, Mr. Chairman. Good afternoon, members of the committee. I'm Matt Kent with the Department of Administration. I'm here this afternoon on behalf of the Indiana School for the Blind and Visually Impaired and the School for the Deaf. And we're requesting funding to continue the work co-locating the two schools on the current campus of the Indiana School for the Blind and Visually Impaired on the north side of Indianapolis. The funds being requested will go towards several different facets of this project, so I'll just give a little bit of detail on each one of those components. Initially, these funds will go towards site work. This will include prepping areas for future buildings and interior roads that will be used for the construction team and also be used once the campus does come online. The site work will also include laying the groundwork for future utilities and upgrades to the current utilities on the campus to be able to support the new buildings that will come once the campus is completed. A small portion of these funds will be spent on limited demolition. There's several small buildings on the campus that are currently not being used, but they won't be used in the future either, and we'll remove those from the campus entirely. The next portion will go towards renovations. Currently, there are several buildings on the campus that we will use in the future plan, and so we will take those buildings and completely gut them, rehab them, get them up to current standards so they'll be ready for the future campus. Those buildings are buildings F, E, and G. Building F is the administrative building. It's the kind of the iconic building on the campus there with the bell tower, so that will definitely stay. The last bit of these funds will go towards new construction. So and this is the large portion of these funds will go towards buildings such as central utility plant, a wellness center, which will include dining and health, education buildings and dorms, and then also a large parking garage to accommodate not only the construction team, but the visitors and staff once the campus is completed. I'm happy to entertain any questions on this.
Director Jackson.
Thank you, Mr. Chairman. And just to kind of clarify for the committee, I think how the dollars are working out here. So in the presentation that Matt and I gave last week, the new estimated total cost for this project is $655 million. I believe we've already released approximately $33 million for this project, which brings the total need left to $622 million. And if I'm off, it's just a math error, not trying to mislead anybody. With that 622, there's 369 million, rounding here, allocated towards this project. That's the remaining balance in the capital reserve account of about 129 million. The pending reimbursement from IEDC should be completed later this month. And then the 190 million that Chris presented on earlier of the ARPA balance. So that total 369 buys down that 622 and I think leaves a balance, if I did this right, of 253 million left for the project that we'll need to identify for the project. And you can expect in the governor's budget that we will we'll recommend how to pay for that remainder, but that does leave the balance of the capital reserve account now empty after releasing these dollars.
Thank you. The only thing would say is that there's been some discussion on, I know we're not there yet, on what we do with the property where the deaf school is right now. So all I would ask is when we get to that point that you include the legislature on that, especially those legislators that represent that area. I've had some of them tell me that they'd like to have some input on what we do with the land. I know there's been talk about giving to the fairgrounds or to the state fair. Private development, but whatever that may be, I just ask that you include us specifically, those that represent that area.
Certainly.
Senator Melton.
Thank you, Mr. Chair. I wanted to ask Zach a quick question real quick, just a little clarity. For the 190 million that's being requested to go into the capital reserves, can you explain that a little bit in terms of that fund itself and how was that decision made? Is that going to be during a legislative process or?
Yeah, so again, the capital reserve account in the 2021 budget received an appropriation of 550 million, and it listed some projects there specifically, but also had some or other projects as approved by the budget committee. I would say there's been some projects that some dollars that have been released for IEDC projects under that other things as approved by budget committee category, as well as I think almost every project that was contemplated is now with inflation much higher than originally anticipated. And so of that 550, the remaining balance after some of the things have already been released is 129 million. And then in Chris Johnston's presentation a few minutes ago, he was talking about basically the remaining ARPA dollars, designating those through Budget Committee towards replenishing the capital reserve account. And so that brings, that's about $190 million that we would add kind of back to the capital reserve account. And then also, just as a reminder, when IEDC got some of those funding for the Boone County project, they committed that they would, as they sold the land, those proceeds would go back to the source, the capital reserve account. And so we've received indication that $50 million will be deposited back before the end of this month. And so those combine to that 369. Does that help?
Yeah, I guess my concern was, is this going to be legislative approval, or is it more or less executive in terms of making those?
Was it 1193, Joe, the bill that requires? Okay, it was 1193. Okay, so House Enrolled Act 1193 had a few different provisions in it, and that was from 2021. In addition to kind of the constitutional powers kind of question that was there, it also basically provided that when it comes to the stimulus dollars, if the General Assembly is in session, right, they will be the ones that determine how those dollars get used. But if there's things that come up whenever the General Assembly is not in session, it was kind of granting that oversight to Budget Committee to reauthorize the use, or as more dollars come in, making those available. But it was kind of deferring to Budget Committee while the General Assembly was not in session.
Okay, last question. So is 190 million already spoken for in totality?
The General Assembly appropriated, I'll say virtually every cent of what we thought the ARPA dollars were going to be worth. I'm looking at Chris, 3.2 billion, but essentially General Assembly told us how to allocate every single dollar. These were the dollars that have been left over after projects have been completed, or as some of those appropriations made by the General Assembly, I think, were determined not to be eligible uses of those dollars.
But it's been allocated but not appropriated.
They were, I believe the General Assembly appropriated every bit.
If I may, Senator, so when the budget was being developed in 2021, the General Assembly appropriated $3.1 billion. At that time, we did not know the full funding that was going to come from ARPA, and actually we collected, or we're going to collect $3.3 billion. So that's the difference, the 3.3 less the 3.1, which we knew at the time and the General Assembly appropriated. That 203 from the Capital Projects Fund came in after the budget was adopted. Then it had all of those strings attached to it to use it specifically for the broadband. So the $250 million is most of it's getting funded by this Capital Projects Fund, which then freed up this other money. It nets out to $190 million, which hasn't been appropriated and hasn't been allocated by this committee. So that's why it's being brought to this committee. Yeah.
Chairman, I'll break that down a little bit. So when we used some of that money for IEDC, I said we needed to backfill that back to these projects. And so I believe at the time there was $150 million left in the ARPA money. And then from the 21 budget, there was the career accelerator of 70 or 75 million, 75 million that was determined could not be used for that type of program. So then that money reverted back into the ARPA funds, which took it up to 190. So I said, or asked, if we can use that money to backfill, and also the IDC giving their money back, because that was part of the thing too. If we do these projects, the Lebanon thing, we need something back to replenish that. So that's why we're taking the land money back, and we use the ARPA funds. So we weren't taken away from these capital projects. So, and then with the remaining balance, it was decided that the only project big enough to take that much money would be the deaf and blind school. So then I said, fine, then just take it all for the deaf and blind school, and then we'll do the balance in the, so there's a couple smaller projects, I think, still in the capital that were available for uses in that fund that didn't get completed because of the overruns. So when I sit here and say we're $1 billion short, that's what I'm talking about. So the difference in the deaf and blind school and then all these other projects that we talked about. So I did have discussions with them on that money, and that's how that came to be, that it backfilled that account. I just felt if we took it out for IDC, we have to backfill it. Representative Porter.
Thank you, Mr. Chairman. And to piggyback a little bit on Senator's comments, I'm concerned about the 190, and we've talked about this $190 million. We as Senator Milton talked about some issues up in his community that we would look at that $190 million. Now we're just taking it through a bill saying, taking it out of the General Assembly's purview, now saying that this budget committee, which, as a member, very rarely get anything to ask for, is just going to take the money and now put it away for capital investments. I think it's premature. I don't know why we're doing this so quick. The money does have to be spent until 2026 or allocated in 2024, something like that. I just, and I thank Chris for talking about it last week, but I'm concerned about it is we doing it right now. That's my pause, and I have nothing ethically against this.
Senator Brown.
I have served on the board for the School for the Blind and Visually Impaired for about 6 years, and they have done an amazing job. And the need and urgency for that capital project to be funded and started and completed could not be more, I don't want to use the words dire, but important. And so the fact that we have $190 million in through all of this process, I think is outstanding in terms of how you have managed the ARPA dollars, and the fact that we're able to backfill and continue the progress on this project is important. And I think it sends an important symbol and sign and message to those 400 plus children from the schools for the blind and visually impaired and the schools for deaf and hard and hearing, that we think this is one of the most important projects and we will continue to keep it moving forward. So I appreciate your bringing this forward.
Anyone else? All right, thank you. Next is NDOT, Steve McAvoy.
I believe I've got one more project. It's a little smaller. It might have slid through there. Very important, though.
Oh, sorry. After
We can pull it
300
off
some
on it.
million, I kind of missed that one.
A little smaller ask here from the Department of Administration. We were asking for $425,000 to completely overhaul the drive machines and the controllers on 2 of the elevators here in the State House. These current components were installed in 1997, and as they're aging, we were having trouble replacing the parts, and it's leading to longer downtimes, I'm sure most of you have noticed. The control systems will be completely replaced with modern-day systems that allow for continuous monitoring of the cabs, and it will notify us of any malfunctions and when services are due for the cabs. We'll be sure to maintain the existing historic nature of the inside of the cabs. The only difference will probably be some new operating plates and some push buttons. So once this current session we're going into ends, we will take 2 of those elevators. We'll actually just take one offline at a time. It'll take about 12 weeks to get it completely refurbished, and then we'll go ahead and do the other one. And then we do have a request in the FY24-25 budget to get the other 2 elevators as well.
Sorry, I missed that one because those elevators are horrible.
Very important.
So any questions on that one? All right,
Thank you.
Well, you've waited patiently through all the meetings, haven't you?
Learned a lot today.
Yeah.
Thank you, Mr. Chairman. Steve McAvoy with NDOT. I've got 2 projects on the agenda today. The first one is that NDOT's formally requesting funding in the amount of $450,000 for the A&E fees for the construction of a 7,000 square foot unit building and a 17,000 square foot salt building at at Roselawn at our existing unit site there. The new unit building will replace the existing 1,800 square foot unit building. It's a metal unit building, one single bay that was built in 1964, and the existing salt building that was built in 1979. So we will demolish both buildings and just build new buildings on the existing site. So these buildings, the unit building that dates back to 1964 has got significant issues with OSHA and work clearances and ventilation problems, doesn't meet ADA accessibility at all. We can't wash our trucks properly, so they're washing them outside, which leads to significant stormwater problems. So this is just a continuation of our unit building construction program. So, any questions?
Questions? All right, next.
Second project is also a unit building and a salt building project, but this is for the construction of the Mishawaka unit building and salt building. So we're requesting $7.1 million to construct a 7,000 square foot unit building and a 17,000 square foot, 4,772 ton salt building in Mishawaka. So this unit building will replace an identical unit building to what we have in Roselawn, 1967 era metal building, single bay, same problems that we have at Roselawn with ADA and environmental concerns. This project will combine 2 units into one. So we're going to move the Mishawaka unit to a new site in South Bend that we recently bought, and we'll consolidate our South Bend winter site with this one and then close both sites and sell those properties when we're complete. So, any questions?
All right, thank you.
Thank you.
Next, we have DNR, Kirsten Haney.
Thank you, Mr. Chairman, and good afternoon, members of the committee. We have one project for you today. So we're requesting an additional $1.31 million to fully fund the rehabilitation and restoration of the DNR building at the State Fairgrounds. We originally brought this project to you guys in April of Budget Committee this past year at a cost of $750,000 based on the cost estimate report. The bid documents did come in higher. That's actually an increased total project cost of about $2,060,000. This didn't change the scope or anything with the project. It's just simply requesting money to fully fund it. Happy to take any questions on it.
Questions? Thank you.
Thank you.
That's all the agency projects. So we have one university project, Purdue University, Relation Ops Center.
Thank you, Mr. Chairman, members of the committee. So we do actually have a few projects on the agenda today. The first one is the library study space renovation. This is totaling $10 million being paid for from our operating reserves. This project comes as another project that's aligned with our strategic plan, Purdue Next Moves, in specifically Transformative Education 2.0. It's the first project to come out as a result of our new library system master plan as well. So compared to national standards and peer benchmarking, Purdue libraries have a combined deficit of approximately 3,000 study areas. With our enrollment growth, one thing that we have seen that we need is more study spaces for students. This is a complaint that our facilities people receive from our students. And so this project helps to address that. We will be moving 1,750,000 books to one location. They will be placed in high-density shelving units. And then we will also be setting up a on-demand retrieval process through these libraries where the students can receive the books. We will pledge to get these books delivered to students in a specific amount of time, so that there will be still the ease of accessing the books, but with more study space on campus. The next project is the University Hall and related renovations. This is a total of $4.6 million with 46.6 million, with 36.6 coming from operating reserves again, and then 10 million in gift funds. So this project includes a complete renovation of 34,000 gross square feet of University Hall. It's the oldest building on campus. We will be doing partial renovations of about 28,000 gross square feet to Beering Hall of Liberal Arts and Education, as well as almost 12,000 gross square feet of Stanley Coulter Hall. This is all in the West Lafayette campus. These renovations are going to support the current and future needs of the College of Liberal Arts by creating a 180-seat active learning classroom and student-focused study and collaboration space on our campus. We will also, with this project, be demolishing Hevelin Hall. It's about 97,500 gross square feet. It was an academic building, and so in total with this project, we will be seeing a reduction in assigned square footage, which does affect the R&R formula that you help to fund. Any questions with them? So our next project is the Purdue Memorial Union second floor hospitality renovation. This is $6.3 million, with $5.3 coming from auxiliary funds and $1 million from gift funds. We are renovating existing space, that's general meeting and office space, and we will be turning it into corporate meeting space, and we will also be adding a spa, which will be managed by the adjoining Union Club Hotel. Our hotel that's been recently renovated is in the Autograph collection of hotels, and many of these have spas as well. The spa will also give students in tourism and hospitality management program more real-world experiences on campus, and then revenues generated from the renovated spaces will reimburse the auxiliary funding sources used for this project. Okay, the next is a lease. This is a Fuse lease totaling $1.3 million. You might remember this from last year. We entered into a lease for additional housing with Fuse. We are doing this now for the 2023-2024 academic year. It's a 12-month lease for 126 beds in the Fuse facility. It's a, they have 2- and 3-year bed options. What we're seeing in the West Lafayette market from last year to this year is about a 5% increase in rent. For our rooms that we will be offering, they will be a 4% increase in costs to the students as compared to last year.
Questions?
Okay, so the next is our deferred maintenance appropriation, which was in the 2021 budget. We received $3.5 million. We are dividing that 3.5 between our two regional campuses equally. In Fort Wayne, we will be doing some bridge maintenance on the Vinderley Bridge. We will be replacing a roof for the Gates Sports Center. And then we will be doing some passenger elevator modernization for Helmke Library. At Purdue Northwest, we will be doing a building roof replacement and then updating some of our classrooms.
Questions?
Okay, so the last item we have before you is the Purdue Fort Wayne academic expansion. This was a appropriation in the 2021 budget for $2.4 million for Purdue Fort Wayne to expand in certain key areas. So last year when we brought this to you, we were estimating that we would add about 5 faculty members per fiscal year. I can tell you that to date, we have 10 faculty positions that have been added in the departments of accounting, management, marketing, computer science, as well as the School of Polytechnic. These faculty positions align with 3 strategic hiring pathways, being strategic and risk management, financial services and financial information systems, data science, applied statistics, and computer information systems, as well as materials, biomaterials, and bioengineering.
Thank you, Mr. Chairman, mention that I appreciate that you're finally receiving the funding for the academic expansion. You've been very thoughtful, and these programs directly relate to needs in our business community for expansion, so I appreciate that. But I just want to say for number 5, the deferred maintenance on the Venderley Bridge, and you can tell me later because there's another bridge that goes across 930. I'd like to know if typically when we have the naming rights and receive gift funds, if they also try to include maintenance costs going forward.
Okay,
Thanks.
I will check on that.
Anyone else? Director Jackson.
Thank you, Mr. Chairman. Alicia, I'm just curious, in terms of the historical R&R formula, I think the General Assembly tries to fund a 0.5% a year of the replacement value, or something along those lines.
I believe it's been a quarter of a percent per fiscal year for a total of half.
So 0.5% over the budget. Do you guys put that directly in your operating reserves, or does that go towards a different fund?
No, it does not go into our operating reserves.
Okay.
And we additionally put in our own money. We budget money in addition to that which we receive from the state for our kind of yearly R&R maintenance across all of our campuses.
I'm not sure I need to know the balance, but in terms of your operating reserves, obviously there's the funding from the state. I assume your tuition fees go in there. What else typically goes in there?
I would have to check with the other smaller sources. That's a majority of it, tuition and fees and state operating appropriations.
Okay. All right. Thank you.
Anyone else? All right, thank you. So next, we've got the review items. First up is State Department.
I don't think I know how to pull up the slides. I'm sorry. Okay, sounds great. Sounds like it's in your packet. First of all, I want to thank the Indiana General Assembly for the $45 million that you have appropriated to the Hoosier Families First Fund. I'll be presenting on behalf of FSSA, the Indiana Department of Health, and DCS today. As you know, Senate enrolled Act 2 established the Hoosier Families First Fund to grant $45 million through DCS, FSSA, DHS, or the Indiana Department of Health in the following categories. I think you should be able to see that on the slide in your package. And there were other appropriations included in SEA 2, including Nurse Family Partnerships, Safety Pen Funding, Child Care Development Fund, Real Alternatives, and Newborn Safety Device Grant Program, et cetera. And I think you heard a lot of that presented on yesterday. But the purpose of this presentation is to review how the $45 million fund has been allocated. Consideration was given to existing evidence-based programming that spans across the fund's purposes, as well as which areas were funded through other specific appropriations in SEA 2, such as the newborn safety devices. Our Department of Child Services will grant up to $2 million to allow licensed child placing agencies to recruit high-quality foster parents who are willing to take in children of various ethnicities or who have mental, physical, or emotional needs. This grant opportunity is currently open and has an application deadline of January the 20th. The grant of up to $500,000 will be used to increase non-recurring adoption expense payments to the federal cap of $2,000 to DCS adoptive families. This will defray adoption costs and further incentivize Department of Child Service adoption for families. $150,000 will be used to expand the non-recurring guardianship expenses, and this will support kinship caregivers to seek legal guardianships by decreasing legal fees and decreasing costs to families. DCS will also grant up to $2 million to allow Healthy Families of Indiana, a home visiting program available in every county to be able to serve 300 more families. Healthy Families of Indiana is an important program that My Healthy Baby refers women and families to for support during pregnancy and after the baby is born. And in fact, in 16 of our counties right now, they are the only home visiting program. $2 million will be used to develop a Healthy Families of Indiana workforce development program to help Healthy Families of Indiana providers to strengthen home visitors and their skill base and provide technical assistance to the sites and support home visitors who serve non-English speaking families. $4 million of Community Partners for Child Safety, which is a program that provides secondary child abuse prevention service, and this will allow CPCS to expand the population that they serve to pregnant women who cannot be served by existing home visiting programs and will impact more than 1,400 families. Moving on to FSSA. FSSA and the Department of Health will use $2.25 million for technical assistance to establish recommendations around registration, training, and potential future Medicaid reimbursement of home visiting and doula programs. This technical assistance will also work in collaboration with the Doula Reimbursement Advisory Board established during special session. $1.375 million will be used to expand Medicaid coverage for non-invasive prenatal screening and carrier screening for conditions such as chromosomal anomalies, cystic fibrosis, spinal muscular atrophy, and sickle cell anemia without requiring pre-authorization. $855,000 will be used to expand the Be Happy helpline to perinatal services, which I think you heard about from Secretary Rosiniak yesterday. And that's basically a phone line to connect providers across the state to a psychiatrist. And it'll now be also, in addition to children, it will be available for our pregnant and postpartum patients. FSSA will also provide $7 million to increase first step rates to market rates as established by a recent rate study. This funding would allow increased rates to go into effect on 1/1 of '23, and it will allow us to bridge funding until the next biennium. First Steps programs are experiencing access issues, and there is a concern as their wait list continues to grow. $1.4 million will be used to establish a LARC grant inventory program, which will allow physicians and clinics to be able to stock LARC devices on site to improve same-day availability for patients. Opportunities for providers to apply will be made available in early 2023. Moving on to the Indiana Department of Health. $4 million will be used to support the perinatal levels of care, which is our next step in levels of care for providing surveys and the level of care for which hospitals can provide for neonates and for pregnant women. This funding will support the 10 perinatal centers to provide additional training, data analysis, quality improvement programs to the affiliate hospitals. $2 million will be used to fund a centralized data collection and analysis platform to allow our My Healthy Baby team to be able to review outcomes and to follow the client's level of engagement with home visiting program that she is referred to within her community. This will assist in identifying and sharing best practices and infant mortality strategies across the state. $1 million will be used to develop a marketing campaign to expand the awareness of Mom's Helpline. This service is accessible to all pregnant, preconceptual, and postpartum women, not just women covered by Medicaid, and it will connect them to resources and services within their community to assist with a healthy pregnancy and baby. And $9.54 million will be used to fund Indiana's Title X grantee, which is the Indiana Family Health Council, which provides low or no cost preconceptual evaluation, full-range contraceptive counseling, and STI testing for little or no cost. The plan is extend to an additional 31 counties from 20 by partnering with federally qualified health clinics and community health clinics. Ongoing funding for this item is set to be $4 million annually while we wait to see what the program uptake will be. And lastly, 10% of the overall Hoosier Families First Fund was reserved for an open grant opportunity, therefore $4.5 million. Providers and community organizations with programs in one of the 8 eligible categories will have the opportunity to submit proposals and receive funds via a competitive bidding process. The FSSA Community Catalyst Grants will serve as a model for the funding opportunity, and the program will be similarly administered. The funding opportunity will be administered via a request for services with application to be released in January of 2023. I'm happy to take any questions that you may have.
Questions for Dr. Box? Senator Brown.
Thank you, Mr. Chairman. Quickly, what's the deadline for this $4.5 million that hasn't been spent yet?
So
The
since
grant
that,
opportunity.
we haven't established a deadline for that yet because that's not actually been offered yet. But it'll be offered, we believe, in January, so it'll probably be within the first quarter.
All right, could your office send me that information? Because I know there are possible grantors who would be,
Yep.
or grantees, I
Happy to
guess,
do
who are
that.
interested. Thank you.
Any other questions? All right, thank you.
Thank you.
Next is Allison Taylor, FSSA. And, you know, I'm going to keep moving here. So the next up is going to be Doug Huntsinger, I should say, with the opioid settlement. So I'll start naming two so they can start coming in so we can kind of keep moving. So the floor is yours.
All right, thank you. Thank you, Chairman. Members of the committee, Allison Taylor, Director of the Office of Medicaid Policy and Planning. I have a handful of SBA and waiver amendments for you. If it's all right, maybe we can start with a HIP phase out so that way I don't forget. And I've been before you, we've done this before, but as a reminder, half eligible hospitals pay an additional amount of funding, about $11.5 million annually, to be deposited in a phase-out account in the event Healthy Indiana plan would be terminated for some reason. And then relatively recently, their statute was passed that would allow us to bring as a review item to this body the notion of kind of waiving collecting those fees for the year. We've done that the last couple of times, and we're here to present that same opportunity. Healthy Indiana plan has received a 10-year renewal. It is strong and stable, and we, in partnership with the hospitals and hospital association, don't think that we need that $11.5 million to be put aside for potential in the phase-out fund for this year. So we'll just present that to you as a review item.
Questions?
Okay, great. Moving on to the agenda. First, we have a state plan amendment that involves our single preferred drug list, or PDL. And so after collaboration with our providers, we are pursuing a statewide uniform preferred drug list, that's called a PDL, for all of our Medicaid programs. Right now, through our fee-for-service program, we have one PDL that a provider will look towards when they're working with that particular patient population. And then our health plans, our MCEs, they have their own, and they're not necessarily the same. And so you can imagine there is definite provider abrasion and even member impact in having that varying PDL. And so we are making, and we're really excited about this, to move to a statewide PDL where we will set one PDL, and that will be the Medicaid PDL. And we think there will be a lot more better member and provider experience for that. And so that's one component of this state plan amendment. Additionally, as a result of that move to a single PDL, the state will receive the supplemental rebates for those pharmaceuticals, whereas in the prior environment, the MCE would get the rebates for their particular PDL. Now, because it's one with us, we will get those rebates. Third, we are also adding language, which we're really excited about, that would allow the state at a future point to incorporate value-based purchasing into our pharmaceutical space with drug manufacturers. This is a trend we are seeing across states. CMS strongly encourages it. So before we can do that, we need that sort of enabling language in our state plan amendment or contract with CMS. So we'd like to get that language in there now so we can work on and envision kind of what are value-based opportunities in the future and have a smoother path to get there. So that is what is in this state plan amendment.
Questions? Senator Brown.
All right, I think I've asked this earlier, and you can get back to me. So maybe I'm confused. I thought we were already receiving all the rebates from the drugs, but maybe that's on our own employee plans and not the managed care plans, which we should have probably been doing.
Yeah.
But my other question is, are we going to have some prior auth issues with the single? I'm a little bit concerned that, and you can walk me through later how you picked it, that there are going to be some patients who are on certain drugs right now that they're not going to be available. And you can tell me how you figured that out later.
Yeah, so we'll have a conversation on that. There will be transition protection. So as we transition to, there will be notification periods. And we've actually talked to the other states that have done this to make sure we are really prepared. I think by far the benefit's going to outweigh that, some of that initial, if there are changes in drugs that need to happen. I think the long-term benefit's going to be huge. We will have to make sure we're super intentional and careful, and I've identified anybody that's going to need to change drugs, and we'll have a plan for those folks. So, and I'm happy to connect with you offline about that in more detail. Okay. Yes, understood. Definitely understood.
Anyone else? Continue.
All righty. The next item is our Healthy Indiana Plan Prescription Drug Supply Benefit State Plan Amendment. So this is essentially cleanup. For reference, all of our Medicaid programs, including the other half of HIP, which is HIP Plus, we basically allow up to a 90-day drug supply. That's pretty consistent. That's like what commercial insurance do. That's pretty normal. We happen to have, for HIP state plan though, it had always been a 30-day limit. During the pandemic, we allowed flexibility up to 90 days. And as you might expect, we saw much greater drug adherence, just a much better outcome, and it helped us realize, gee, not really sure why, but this population was sort of left out to that, from that 90-day access. So we are submitting a state plan amendment that would allow HIP basic members to kind of come into the fold with the rest of our best practice across Medicaid.
Questions?
Okay, thank you. All right, so the next item is a renewal for our adult mental health habilitation waiver. And as a reminder, this is a small program that we brought before you before. It is habilitative and not rehabilitative. So we're talking about like a really limited population of eligible individuals who have really high level of need. My DMHA colleagues call it ANSA 3 or higher, and it's really that long-term serious mental illness and other treatments they've tried and failed. And so this is an important but small waiver, and we are seeking to, it's at its natural renewal point, and thus this is just our request to extend it through the next cycle.
Any questions? Continue, please.
Okay. Our next item is a renewal of the aged and disabled waiver. And I know this is a waiver, but that's probably much more familiar to this group. So the A&D waiver, it's our waiver that provides alternatives to nursing facility admissions for those adults age 65 and older or persons of all ages with disability. And it's what we use to help individuals get the supports that they need to stay home, or in the community, or in the assisted living, or in the adult family care. So we are seeking an extension of that waiver. We are adding in a new component, and that is that second paragraph that is on expedited waiver eligibility. We've talked a little bit about this in this space, but as a brief reminder, partly in response to the pandemic and the need to get more folks into the home quicker, partly because we also, this is a goal of our MLTSS reform, getting individuals, aging individuals, access to eligibility so they can get home quicker, because we also know the alternative, it's easier to get into a nursing home. And we've talked over and over about the idea that we really are trying to create options and more appealing paths for individuals to age at home, to get to home. So we have what we're calling a pilot, and it's an expedited waiver eligibility pilot where we are partnering with local organizations, some AAAs, and a couple of other providers to test out what happens when we give individuals expedited eligibility. So instead of having it take the weeks and months that it sometimes can take, can we, through some really kind of intelligently designed upfront review, get folks eligible quicker, and then do some of the auditing, like finish out some of the paperwork on the back end. And so we've been doing that over the last couple of years, and it's been very successful. We are seeking approval from the federal government to make that permanent, to make that a part of the way that we do business. And so we are hoping to work with the feds and put that into this A&D waiver. And so that's kind of why you see adding on that concept to this existing waiver. And I'm happy to answer any questions. This expedited eligibility, it would come into play 6 months post PHE, so it's a bit of a moving target of when we would need to transition to the full. But anyway.
Questions? Senator Brown.
Thank you. I appreciate you. That is a huge concern I've had, how long it takes to get eligibility. But I also hope you would look in the future. Not ours and my community have done a great job, the AAAs, but I've heard some are a little slower, and probably not their own fault. But that is a problem.
Yeah.
Thank you.
Agree.
Other questions? All right, continue.
All righty. So the next item is the child mental health wraparound waiver renewal. And there are a couple of amendment aspects. For this, we call it the CMHW. 1,300 people are in this particular waiver. And we are seeking to renew it or extend it, and also adding a couple of items, exclusive provider role for wraparound facilitation and additional training support for unpaid caregivers. Let me flip back and see if there's what else is in. Yeah, in respite care. So those are some enhancements that our DMHA partners have identified to better serve these individuals. Again, around 1,300 individuals in the waiver. Happy to, or I guess I will pause there.
Questions? All right.
Okay, that's it. Thank you so much.
Thank you. Next we have next we have the opioid settlement distribution plan, Mr. Hunsinger. And next will be the state police.
Thank you, Mr. Chairman, members of the committee. I'm Doug Hunsinger. I'm the Executive Director for Drug Prevention, Treatment, and Enforcement, and Chairman of the Indiana Commission to Combat Substance Use Disorder. With me is Rebecca Buhner, who's the Chief of Staff at the Division of Mental Health and Addiction. Prior to her recent promotion, Ms. Buhner was the lead for our addictions team at DMHA. We'll be presenting a $52 million plan which utilizes the 35% share of the 2022 and 2023 payments from the national opioid settlements that have been appropriated to the Family and Social Services Administration, which this body is required to review per the legislation that governs the distribution of those funds. In the development of our plan, we looked at other funding sources that we currently have and the activities that are taking place under those funds so that we can begin to braid funding together to fill gaps and create sustainability. This includes our state opioid response grant funds and substance abuse block grant funds that we receive from SAMHSA, CDC funding that the Department of Health receives. And over the last 9 months, we have spent a lot of time meeting with our stakeholders, including the Association of Counties, AIM, our Sheriff's Association, community coalitions all across the state, community mental health centers, MHAI, state medical, the Hospital Association, and many other providers. We've also met with community foundations and philanthropy. We've met with the Northeast Mayors and Commissioners Caucus. And in addition, we've had many other individual meetings with mayors, commissioners, and councils across the state.
And one common theme that we heard from all stakeholders is that they wanted assistance in working together within their county, but also regionally across county lines. And as many of you are probably aware, of the 648 units of local government receiving payments, not all of them are going to receive enough money to be able to do significant activities within their community. So that is why we are proposing a $25 million matching program as part of our plan to help communities connect and collaborate as they build those connections within the infrastructure the state has been working to build, and also helping them put together evidence-based practices within their communities as well. In addition to the matching program, we have areas that we'll be focusing on for this funding will be treatment, prevention, harm reduction, enforcement in the justice system, and then workforce, because we cannot continue to grow our programming without focusing on our behavioral health workforce. And we'll do that in conjunction with recommendations from the Behavioral Health Commission and the Governor's Public Health Commission as well. And all of this has an emphasis on adolescents who are experiencing substance use disorder or at risk for substance use disorder. So the plan was distributed with the materials, and we'd be happy to answer any questions.
Questions? Senator Brown.
Thank you, Mr. Chairman. Quickly, you said 35% of the settlement received is the 52 million. So where's the other 100 million going?
So the settlement funds are split 50-50 between the state and the local units of government. 15% of that is then unrestricted funds that are currently being held in the agency settlement fund, and then the 35% was appropriated.
That you are just.
That
okay.
Yes, that we're talking
so
about.
So of the 52 million, 25 million is going to be the match. Right? I think so. That's what, okay.
Yes, correct.
Got it. Can you give me a list when you know who is actually participating in that match? I'd like to know, at least in my community. You don't have to give me the whole state. Thank you.
Absolutely, we will.
Anyone else? All right. Thank you.
Thank you.
Next, do we have the state police? And then we will have DNR.
Afternoon, Mr. Chairman, members of the committee. My name is Shay Relaford, Assistant Commander, Human Resources Division. On behalf on Superintendent Carter and Major Sorrells, unfortunately couldn't make it today, so he does send his regrets. Have with me HR Manager Pam Douglas and the Benefits Commander, Lieutenant Ronell Williams, our insurance consultant Marcus Bowling, and from our actuaries, McCready and King, One America, Phil Loftus, who all share in our efforts and success. So I want to thank them for being here. Highlights of the document you have before you are that there are not going to be any plan design changes or increases for 2023. And for the OPEB, with the addition of our Medicare Advantage plan, that was a great addition. There were no plan design changes have increased our liability. With the assistance of technology, we're able to connect with our members and their families throughout the year in education at different times of the day. And we put a high emphasis on high-risk health conditions such as diabetes and hypertension, those that affect one's health and costs, and encourage members to have a relationship with their primary care physician. Having this relationship is one of the main factors in preventing and treating any health conditions, and obviously keeping costs down. Glad to say we are above benchmarks for primary care physician visits and below benchmarks in ER visits. So again, our members are seeing their doctors more and going to the ER less. Our wellness incentives are going to continue to require that the subscriber complete both their annual physical and the non-tobacco attestation or a non-tobacco program. This ties back to building relationship with your primary care physician and to both detect and deter any health conditions. Further success to highlight is over the last year, the industry trend is in medical claims are up by 6%. While we experienced a reduction of 2.4%. And as we wrap up for the OPEB, when we were notified of the liability, it was projected that we would not be fully funded to 2047. And you'll see in the document, and with the volatility of the markets, we are at 96.3% fully funded, and I will continue to do everything we can to attack the liability. And we will take any questions you may have.
Questions from the committee? All right, thank you.
Thank you. Yes, you do. Happy holidays.
You too, thank you. Next we have DNR, and following would be Marion University.
Yes, sir. Good afternoon. I'm Indiana Conservation Officer Captain Keith Dinn. I have the CFO from the DNR, Kirsten Haney, as my backup, if you will. There's been, as was mentioned earlier, there's more than one person in any of these team activities. So we have multiple actuaries who've looked at the numbers. Gallagher's our consultant on the insurance side. And we have, as I mentioned earlier, plenty of good oversight. Since we met last year, as far as OPEB liability, we have been able to have an effect on our glide path in a positive way by exceeding our ADC, a 6.2% discount rate, and it looks like at this point a 21.5% reduction or a decrease in plan utilization. So looking at that particular glide path, we've been able to decrease that since last year by about 6 years. So trying to maintain that or continue that positive effort there. There's been no plan design changes for 2023. And as a side note, we're currently, since January 1st of 2019, at about $1.6 million in rebates from CVS Caremark. For 2023, we're going to focus or continue to focus on wellness. In this particular year, next year, we're going to focus on cancer screenings and diet and weight monitoring. And first and foremost, any mental health issues or mental health wellness programs that we can participate in with our provider, our carrier. That's all I have, unless there's any questions.
Questions? All right, thank you.
Thank you, sir.
Marion University, then we have Indiana Sports Corp.
All right. Mr. Chairman and the members of the State Budget Committee, thank you for giving me the opportunity to speak today about the Indiana Primary Care Scholarship. My name is Kyle Hattenberg. I serve as Assistant Vice President for Health Professions Enrollment Management at Marion University and the College of Osteopathic Medicine. In our first 6 classes, as of May 2022, we have graduated almost 900 new osteopathic medical students. This coming May, we will graduate our 1,000th medical student. Of those, 230 have participated in the Primary Care Scholarship Program. Specifically for our graduates in the first 6 classes, primary care areas of family medicine, internal medicine, OBGYN, pediatrics, and general psychiatry rank in the top 7 specialty areas our students are completing residencies in. So far this year, as of 11/11/2022, we have awarded 158 scholarships totaling $1.78 million. We expect that number to rise to 172 scholarships awarded by the end of this academic year, as stated in our request letter under the 2022-2023 academic year projection header. Overall, the decision to incentivize students to work in primary care and serve the state of Indiana after graduation has been overwhelmingly positive. One of our core missions at the College of Medicine is to produce primary care physicians for the state of Indiana. Annually, more than half of our incoming students are residents of the state of Indiana, with our newest class being our highest, with 68% being Indiana residents. If you look at osteopathic physicians nationally, nearly 57% practice in primary care, and for Marion, over 60% of our students go on to residencies in primary care medicine. So we are trending towards producing primary care physicians higher than the national rate. We now have almost 60 program participants who have completed residency training and are practicing primary care medicine across the state of Indiana. With that, I am happy to take any questions.
Senator Brown.
Right. You know, I asked this question. So now you have a couple years of graduates who are out of the residency program.
Mm-hmm.
Are you keeping track of them to know if they're paying in compliance with this requirement?
We are. We track that very closely. We have 2 right now that are in default, and ECSI are working with that to remedy that. And then we have 6 that are not in compliance, which we are tracking that as well.
Right, and the 6 not in compliance are the students.
Correct.
That have either withdrawn or been dismissed. And you had a few students last year who were not in compliance.
Correct.
But you are actually keeping track because
yes.
You weren't able to tell me, do you know how many of your graduates this year matched as residencies within the state of Indiana? Because we know that's the last place you train is actually the biggest indicator of where they're going to end up.
Correct. 38% of our overall students matched in the state of Indiana. Program participants, we had just over 50% of those students match in Indiana residencies.
Okay, so the 50% here, there's a better chance they'll stay here. The 50% that didn't match
Correct.
here that received a scholarship, somebody's going to have to track them down if they don't come back to Indiana.
100%. Those students get a letter every year that they have to certify that they're still on track. So if they're out of the state of Indiana, then they're certifying that they're going to come back to take care of that. And if not, then they would have to repay that funding.
Okay, well, I appreciate your keeping track because I do appreciate the fact that most of these are going into family practice, which we need. So
Yes,
thank you for
absolutely. Yep.
Representative Porter.
Thank you, Mr. Chairman. When we first developed this program a few years ago, one of the criteria was that they were individuals who would go to disadvantaged areas. Subsequently, that has been changed, so that's no longer the law. So, and I've asked this on numerous occasions. So, are you still serving in disadvantaged areas? And if so, where are they and how many?
Absolutely. So obviously, I mean, as we know, Indiana as a whole is a very disadvantaged state for physicians. So our students of the 60, they're going all over Indiana. We can certainly get you specific cities and states. There are a number in Indianapolis. There are a number all over the state of Indiana. But I can get you specifics of where our students are practicing.
I would like to, if you will, attend to state budget agency so I make sure I get it. Other than that, I never get stuff. Thank you.
Senator Kadora.
Thank you, Mr. Chair. So I just want to follow the math for a second, if you don't mind. So in total, you're about to help graduate 1,000 students, correct?
Mm-hmm.
Out of the 1,000 students, only 60 stayed in Indiana. Is that
no,
correct?
that's actually of the program participants.
The scholarship program part?
Yes, absolutely.
Got it. So the program participants, look at the first page of the scholarships. You issued 158 total scholarships, correct?
Those are current students, yes.
Are these unique, meaning that when I look at 2023, you have 69, and then year 2024, you have 34. So are these unique individuals, meaning that the same person who got the scholarship in 2023 will be the same person who got in 2024, 2025, 2026? Are these numbers on each line unique individuals, or they're cumulative? They just
so it could be a couple of different things. So a student that starts in the first year, they get that full funding for 4 years if they continue to go towards that route. There are students that can decide in their second, third, or fourth year. So there are matching funds, but not the entire amount. So those could be different numbers based on the year. Does that help?
Yeah, I'm trying to do the math here, and that's why I asked that question, because if they are unique or non-unique, that changes the answer.
They're not unique.
They are not, they're duplicative, correct?
Correct. So a student could get 2 scholarships in 1 year, one being so they could get like $10,000 for the second year if they start in the second year of their medical school, and then there's a catch-up fund. It's not the full amount, but they could get, for instance, $7,500 to catch up.
Okay. That, I think, if you don't mind, separately, maybe if you can help me, if you can send me an email of the number of unique individuals, if there's a way to look at the number of unique individuals because that could be either a very positive good news or it could be not good news. Meaning, if there are, let's say, 60 unique individuals receiving those 158 scholarships, and you have 60 people stay in the state of Indiana, that's a very successful program of 100% retention.
Yeah.
But if that's not the case, then that gives us a different percentage of your ability to retain students, because we know that once you finish residency, you get matched here, you can leave the state of Indiana. And that's the problem that I have, that I've been, and I appreciate the conversation I had over the summer with multiple state agencies about the cost analysis of folks that we pay for and then they leave the state.
Yes.
So if you can give me that answer, that would be greatly helpful.
Absolutely.
I appreciate you.
Yep. Anyone else? All right, thank you.
Thank you.
Last up is Indiana Sports Corp.
Good afternoon, Chair. Thank you. Committee members, thank you for allowing us to come in today and speak about the great work that we've been able to do across the state and within Marion County. I'd also like to give a shout out to Representative Porter for being on the Sports Corp Board. Thank you for your service and your time. Really appreciate that. We've had a big year in 2022. And first I want to start off with, you'll see in the packet there, we have Big Ten Conference support. Great year for the Big Ten. Last year we hosted the men's and women's basketball tournament as well as the football championship game. Over $37.5 million in economic impact between those events. We saw record attendance in the women's tournament with over 42,000 people attending. And the Big Ten football championship saw the second highest attendance of all time, 67,000 people enjoying watching Purdue and Michigan play in the championship game. We have secured 2023 and 2024 Big Ten football championships. We'll be here in Indianapolis in the next bid cycle for games for the basketball as well as the football for 25 and 26 will be released in Q1 of 2023. So we will be bidding on those. Really excited about that. On our event attraction efforts, since I took over as president of the Sports Corp in July, it's been a short less than 6 months. But one of the things that we've really focused on is working with our across the state and going around, and I made an effort to make sure I was meeting with people in different areas. Took a chance to go up and see Benix Arena up in Fort Wayne, tour that with the eSport Arena because that is a new and area of focus for the state as well as for the Sports Corp is esports and what that can bring to the state. Second, met with Turnstone up in Allen County. I also have phone calls with the War Memorial, Allen County War Memorial general manager, the new one up there, Melanie. Had phone calls with her on a regular basis, and then down in Evansville, have regular calls with their sports commission down there, Eric Marvin, and working to understand what it looks like in their spaces and what they need from support across the state. We also were able to travel to Colorado Springs and meet with USOPC as well as other national governing bodies to talk about events for the state as well as for Marion County to bring different events to that. What that has also led to is I was invited to speak on behalf of the USOPC at a conference, a Teams conference with other sports commissions from around the country as well as other national governing bodies to talk about the ability to bring smaller national governing bodies together to do events to have impact in communities and what that could look like and how we look to do that in Indiana and how we want to continue to achieve that goal. We also traveled to Chicago to deserve the WNBA All-Star Game for a potential future bid on that. We were able to pay for bid fees for USA Water Polo, a Pan American under 18 event at the Natatorium. We also were able to pay a bid fee for USATF to host the half marathon national championship, and we actually saw a U.S. record taken on that, and that was in conjunction with the mini marathon for that weekend. We also met with the USA Blind Athletes Association, and they have actually taken on USA Blind Soccer as well, which is really a exciting opportunity for Turnstone up in Fort Wayne as well. So we're very excited about those opportunities. We secured a Final Four, women's Final Four in 2028 and a men's Final Four in 2029. So that means we have three Final Fours in 4 years, 26, 28 for women's, 29 for men's. And the event attraction money was able to allow us to put those bids together. In 2022, we've secured over $500 million of future economic impact, which we're really excited about. That ranges from the NBA 2K League Season 5 to the USA Track Half Marathon, the Olympic Team Trials Swimming, 23-24 Big Ten Football Championships, 24 National Invitational Tournament Basketball. It'll be at Hinkle Fieldhouse. It's the first time that event's leaving Madison Square Garden for the NCAA Men's National Invitational Tournament, 2023-2024 NFL Combine, and of course, the internet sensation, the Savannah Bananas, will be having a game at two games at Victory Field in June of 2023. Really excited about that. So with that, I'm going to ask my colleague William to talk about the overall state work that we've been doing as well.
Good afternoon, everyone. William Knox here representing Team Indiana. And as many of you are aware, Team Indiana is the collection of communities across the state that have come together to market the state as a destination for tourism, sports tourism in particular. 3 years ago, we transitioned that organization to be a part of the ISC team. Prior to that, it was its own standalone organization. Through the leadership at ISC and the board at Team Indiana, we thought it was important that we bring these organizations together such that we didn't have a lot of redundancies with staff and things of that nature. So it's been a great partnership to date. From the very inception of Team Indiana, ISC has been at the table, so things have really been going well. Our pot of funds are split into 2 sections, one of which is our Community Event Bid Support Fund, which has a graphic in your packet that shows some of the results of that fund from this year. With over 27 applications, we awarded $259,000 of event support in 2022, and that was to 14 different communities. As a result, there is about $10 million in economic impact throughout the state that came as a result of those different event opportunities. We still have 4 events that are yet to report this year, so this number will increase and we'll make sure we can report that out. Those funds have been very important to a lot of our communities throughout the state who are attracting bid events, as the landscape has gotten very competitive over the last few years. Post-COVID, there's what we're calling this mass consolidation of events. So there's fewer events out there, and many of the communities throughout the country are aggressively pursuing those activities. So these funds are very important as we continue to extend our efforts to bring events into the state. 25,000 room nights contracted as a result. That number will probably continue to go up. And as we look at the event opportunities that we're awarding for 23, there's a lot of exciting things that are going on throughout the state. So it'll be nice to see what that looks like next year. The second pot is our promotions and marketing funds. A lot of these funds are used to help us engage with NGBs and rights holders. Some of them are here in our backyard, but others are throughout the country. So many times we travel to our industry shows, and that allows us to provide some support to our state associations to go out and pursue some of that business. So as we continue, we'll continue to work with ISC and the team there to continue to promote the state as a destination for sporting events.
And as we close, we just want to also thank this committee and everyone who was instrumental to passing the state bid fund last year. That work and that obviously will be very important. As you can see, we've done some great work with this appropriation, and we see a lot more wonderful work coming because of that. So thank you for that. And with that, I will open up for questions.
Questions? Senator Brown.
Thank you, Mr. Chairman. Thank you. I know you did visit Turnstone, but I just want to point out it's more than an event place. That it is the only Olympic Paralympic training center in the state. There are only 5 Paralympic training centers, so I hope you continue to pursue that. It's not just a place where there is an event. It's called Goalball, is the blind soccer, and they have actually won medals at the Paralympics in the past. So I'm looking forward to you working outside Marion County and promoting that. Thank you.
Thank you for that. Actually, that is something very important to us that we work with them closely. So they're doing great work. Thank you.
Anyone else? All right.
Thank you, Mr. Chair, committee members.
Are there any motions to remove anything from the agenda? Order.
I won't remove anything from the agenda, but I just want to make it perfectly clear that the $190 million that I was concerned about was something that I've always talked about and been watching for a while. Representing, and thank you, Senator Mishler, representing the visually impaired community since my tenure, and a lot longer than a mere 6 years, and have been on that committee and worked hard with them, been an advocate to understand and work with the culture and in the visually in the hearing impaired community. I stand ready to continue to work and advocate for individuals within the district that I represent. It is not my district per se, but it's a district that they allow me to represent, which house that community. And I just hope that when decisions like has been transformed by a previous legislator with a committee, that those of us who do represent that area and do care and have been involved and spoke at commencements and been at the fall events, who are entrenched in that community, that we do have opportunity to continue to work in that community, not just as a bystander, but as a policy maker. And I appreciate that. Thank you, Mr. Chairman.
All right, so I'll entertain a motion to adopt the agenda.
So moved, Mr. Chairman.
All in favor? Aye. Opposed? All right. We did it backwards today, but because we did discussion items first. So the only other thing we'll have in front of us is we have to hear the governor's budget before January 9th. So we haven't set a date in stone yet, but that first week of January, because we can't wait till the 9th, the first day of session, that's too late because it's not on or before, it's before. Because my plan was to hear it on the 9th. So that first week of January, we're going to have one more budget committee meeting to hear the governor's budget presentation. So we'll have that here soon. So with that, we'll adjourn. Thank you.